What's up, Refuge Nation? It's your friendly neighborhood Bob here with
Medic Mike.
Medic Mike, and we are here to have a conversation with you in the Back to Basics series. And today we wanted to talk about dehydration, heat stroke, heat casualties. It's hot outside because it's summer, and a lot of people don't know what signs we should be looking for when somebody is experiencing heat exhaustion or heat fatigue or heat stroke, and what we can do to maybe prevent these things, get in front of it before it goes south and a person goes down, because that's really what we don't want. Now, we brought Medic Mike in here because you have seen in the summers of Nevada how many heat strokes, heat exhaustions, heat fatigues.
I lost count. I mean, it's a normal thing every summer, so we're ready for it.
Yeah.
I mean, to be honest.
Yeah, it just is. It just is.
I mean, it's a different kind of heat out there than versus here. It's dry and arid out there, so, but hot is hot.
Hot is hot. That's a great way to put it. So, what are we looking at when we're dealing with heat-related injury? What are kind of the main things that we want to look out for, and how do we identify it?
Most of the patients will be, red and flushed, basically. Some of them are sweating, some of them aren't sweating.
Now, what is the difference between somebody who's sweating and somebody who's not sweating?
You have your heat cramps, which is from physical exertion activities, playing basketball, playing hoops in the summertime, having a good time. And then as that progresses into heat exhaustion, they start getting crampy, they start getting nauseous, they will start throwing up, they can even seize.
Really?
And then, based on what we see when we get on scene, is how we're going to treat the patient. So, I mean, most of them are just weak and like lethargic, like, oh, I feel like crap. But no, first thing we're going to do is obviously, if we had an ambulance with air conditioning, so obviously that's not going to be an option for most people. So, but you want to get them in the shade or get them in a cool place.
Okay.
Place ice packs in their groin and their armpits.
In their like regions right here, right?
Because you want to cool down the core.
The core.
And then obviously in the professional world, you would give them an IV to get their, give them some fluids, give them some, because normal saline is salt water.
Right.
So that's kind of an electrolyte. And then the worst case scenario is heat stroke. And the worst cases of heat stroke, people stop sweating. Like people, if you go in your attic, like construction workers, they'd be up in the attic fixing the air conditioning vent or something in the attic, and they would just literally pass out in the attic, and they weren't sweating anymore, and it's 180 degrees up in there.
Holy
That's
smokes.
bad.
That's a bad deal.
That's like coma time. That's like,
so
we call that Dane Bramage.
You could actually enter into a coma or start seizing or anything at that heat stroke level.
Absolutely.
So how often do you think people are actually experiencing heat stroke versus maybe like heat fatigue
I
or
think
heat
the
exhaustion?
heat stroke is more of a buzzword, honestly, because everyone thinks that if they have a heat injury, I'm having a heat stroke. But the signs and symptoms would dictate, again, from the professional world, would dictate the heat stroke. But it's uncomfortable regardless, no matter how you look at it.
Yeah.
I mean, you're going to feel weak and nauseous and a little dizzy.
Yeah. And that's more heat exhaustion,
Right.
heat fatigue, right?
Right.
And that's onset with heat cramps, right? So we're
Correct.
going to go from like heat cramps to heat exhaustion, heat fatigue, and then after we go through that, that's when you can start getting into heat stroke.
And you're pretty much,
Or passing out.
you're passing out, and that's, basically, almost circling the drain, as we would call it. You're close to death when you're really.
'Cause you can go into full cardiac failure.
Absolutely.
From overheating.
Absolutely.
Right? So some things that you can look for when dealing out in the summer. It's very hot right now. Everybody's got stuff to do. We're not going to hide inside, right? Well, you shouldn't. You should go outside and do hard things because it's good for you.
Absolutely.
But some things that you're going to look for is, normal sweating, it is what it is. And then obviously you're going to sweat more when you're outside. It's at the point where you start to get nauseous, you start to feel fatigued, you start to feel unable to do normal tasks, you're labored breathing, all of these things, that's sign of heat fatigue, heat exhaustion, right? And just like Medic Mike said, what we're going to need to do is get you over to a cooler area. If you don't have air conditioning available, find some shade. If you don't have fans, find a place that is breezy where breeze and airflow can get in. Open up those joints, right? So that way air can get in and we can cool down that core. And then as quickly as we can, we want to get fluids into that person, but we don't want to just get fluids. We want to get some minerals into
for
them.
sure. We're going to get electrolytes in them. Absolutely.
Yeah, so electrolytes, potassium, magnesium, right? Salt is a big thing, right?
Absolutely.
Getting salt into the body is a big deal, right? A lot of people don't realize this, like, your brain is floating in water, right? And so what'll happen is eventually your body is trying to compensate and you're sweating all that water out, and that's why you get that throbbing headache, is you're just running low on liquid in there. And so
people don't drink enough water when they know better.
And we actually looked at this. We looked at what currently, some medical doctrine is on the amount of water you should be intaking. I'm a big fan of a gallon a day. However, the recommended dosage for an American male is 100 ounces a day. So if you were drinking out of an Nalgene bottle like so, this is a 32 ounce. So you'd be doing 3.5-ish of these Nalgene bottles a day. Now, I would go so far and so boldly to say that that's not enough water.
I agree.
It's just not. So I would easily double that. Easily.
Especially in the heat of the summer.
Especially in the heat of the summer, especially if you're working outside. And then I would alternate between just standard water and then maybe some sort of electrolyte or rehydration salt, especially if you're outside working, if you're outside doing physical or fun activities, right? Just playing with the kids, farming.
Breaks. Take a couple breaks, get some water.
Yeah.
I mean, there's no reason to go full tilt boogie and
Yeah, because what you could do is eventually hurt yourself, right? And then you're not productive anymore.
Sometimes people are so involved in what they're doing, they don't even realize they're in that stroke or that heat exhaustion or that heat cramp until it hits them like a ton of bricks.
So what you're saying is you might have to look out for your friend.
Absolutely.
So wait, be your brother's keeper? What? Yeah, with that, but I read that in a book one time.
Book.
So, guys, it is our responsibility to look after one another, right? And so you being Refuge Nation, you care deeply about other people. And so when you're outside doing activities, make sure people are drinking water. Somebody's got to be the team mom, right? Make sure everybody's getting water. Something as simple as a rehydration salt or even grabbing some of the Jocko hydrates. These are good because they have potassium, they have magnesium in them, as well as they do have salt, and it's a little bit of flavor. I personally am not a big flavor guy when it's very hot.
Yeah, but a lot of people are like, water tastes just so bland, but it's your body's made of water.
Water is
Put
life.
more in it.
And then, if you did want to build out a little heat preparedness kit, maybe something to just be preventative, having some extra hydration salts, maybe even having some ice packs, right? We do sell these here, but you could grab these anywhere, right? You can grab them at Walmart, you can grab them at CVS or something like that. But having a couple of breakable ice packs on hand inside the car or inside the work bag, whatever have you, is a pretty good call. We recommend the apples for, or the APLS for a bunch of different uses. This is not in this case, you would not wrap this person in this blanket. That would be the opposite of what we're trying to do. That would trap heat. But what you could do is you could create a hasty shade structure, right? To cast down some shade, to get some, get the sun off of the casualty, whatever situation they may be in.
Yep.
And you can do that really easily with a couple pieces of paracord staged, taped on top of that, and then just string it up and get some hasty shade. And it doesn't weigh much. It's less than a pound. It fits tightly compact in a kit, and it's very easy to deploy.
Former military types will know what it was like being out in the field. If you were in the combat arms, we were making a hooch.
Yep. Yeah, exactly. You're just making a quick little hooch, right? So this is a quick look into back to the basics of just dealing with heat casualties, right? Be mindful. An ounce of prevention is worth 10 pounds of cure. In this case, it is way easier to stay in front of a heat casualty than it is to revamp and bring somebody back from a heat casualty.
And it's so preventable.
It's
100%.
It's so preventable, right? So drink lots of water, just like summer camp. Drink water, have fun. Intake salt, potassium, magnesium, all these good minerals.
If you're going to be that Gatorade person, there's so much sugar in Gatorade.
Yeah.
Make it 50-50 water so you can break up them sugars, because it really is not that good for you straight from the bottle.
And a quick note, guys, anything with caffeine in it is actively working against you. It is working to dehydrate you.
It's a diaphoretic.
Very simple, and so I know a sweet tea in the summer sounds good, but don't do that while you're out working.
It's a diuretic, sorry, diuretic, not diaphoretic.
Get out of here. Who are you?
Big college words out.
Yeah. So we know that the sweet tea in the summer sounds good. We know that maybe some iced coffee sounds good on that hot summer day. It's actively working against you. I much more recommend doing some sort of water, some sort of even if you needed some flavor. Just squeeze a couple lemons in there.
So we're going to get into the little sciencey part now. He said sweet tea. If your urine looks like sweet tea, you are super duper dehydrated. You want like cheap lemonade.
Yeah, yeah, that's a great way, and really that's a good way to see kind of what you're going through. People think that if you're dehydrated, you won't be able to urinate. That's not true. You'll still be able to urinate. Your body will still be expelling toxins. It sometimes will do it at a more rapid rate. However, the coloration of your urine will differentiate. The deeper and the darker yellow that you go, the more dehydrated your body is. And so we want nice, clear, clean, urine. To say it.
It is what it is.
It is what it is. I mean, we're talking science here. This is science.
Sure, science.
Yeah.
He made the body do wonderful things, and that's part of your body.
Yeah, 100%. So guys, when you go out and you're having fun this summer, remember this short little back to the basics. Ounce of prevention worth 10 pounds of cure. Drink water, drink salt, drink magnesium, potassium, all that stuff. Stay overhydrated rather than underhydrated. If you're peeing too frequently, that's a good thing in the summer, because as long as it's staying clear, because it's good preventative maintenance, right? So hopefully this helps. If you guys have any questions, feel free to leave them in the comment section below. We're always down to help you guys however we can.
Absolutely.
That's why we're here. We love you. Carry an effing water bottle.
Carry an effing water bottle.